So my name is Guy Ringler, and I'm a fertility specialist from Los Angeles with California Fertility Partners, where I've been practicing for about 25 years now. And the title of my talk today is The Optimal Embryo, How Do We Get There? And my goal today is to teach you how to maximize your success rates with IVF by optimizing the egg quality, sperm quality, and embryo quality. And this adorable little boy was born several months ago to a surrogate in California. And this is our goal, delivery of a healthy baby at term. And his proud parents agreed to let me show him to you today to help inspire you to follow your dreams of having a baby. So the factors affecting the success rate of IVF include patient age, embryo euploidy and grade. Euploidy refers to an embryo having the correct number of chromosomes. If it has an abnormal number of chromosomes, it's referred to as aneuploidy. Egg quantity and quality, sperm quality, the IVF laboratory, and uterine receptivity. And we're going to concentrate on the first 5 factors today. The success rate of IVF correlates directly with the age of the woman producing the egg. And as you can see from this chart, after age 35 in the woman, there's a rather steep decline in pregnancy rates to a minimal level at age 44, 45. This decrease in pregnancy rates is related primarily to the chromosomal makeup of the egg and embryo. As a woman ages, more and more of the remaining eggs are chromosomally abnormal, creating an aneuploid embryo that is less capable of producing a live birth. And these are blastocysts. These are day 5 embryos. And in these embryos, there's the outer layer of cells are the future placental cells, and the inner cluster of cells, that round area, is referred to as the inner cell mass. Those are the future fetal cells. Fortunately, today we can biopsy these embryos at this stage and test them to see if they're chromosomally normal or not, as Dr. Barbieri talked about. And this schematic just shows the actual biopsy procedure. We start by creating an opening in the zona pellucida, the protective layer around the embryo. We then remove 3 to 5 cells from the trophectoderm, the outer layer of the embryo, and then freeze the embryo and test these cells to see if they're chromosomally normal. And 3 randomized controlled studies have demonstrated the benefit of doing PGS prior to embryo transfer. So it helps us select the most viable embryos, the embryos that are most likely able to produce a live birth. And the next series of slides are going to show the percent of euploid embryos in patients at different ages. And these were performed by Ovarian Fertility, a group of large IVF programs in the United States. And the first slide shows patients under the age of 35, where 55% of the embryos were euploid. From 35 to 37, it decreased to about 44%. At ages 38 to 40, we're down to about 32% euploid embryos. And look what happens over age 40. Ages 41 to 42, 17% of embryos are euploid. And women ages 43 and older, there's just a little boost up, probably related to sample size of about 19.9% euploid embryos. Now, if you switch to a donor egg, and most egg donors in the United States are in their 20s, we see a euploidy rate of about 59%. So these are blastocysts, and we all started our lives as a blastocyst. Blastocysts develop to that stage on either day 5 or day 6 of culture, sometimes on day 7. And this is a stage at which an embryo has the potential to implant into the uterine lining and initiate a pregnancy. Once embryos reach the blastocyst stage, they're given a grade, and the grade has a numerical component 1 through 6, which refers to the degree of expansion, 1 being the smallest, 6 being the largest, and then 2 letter grades, A, B, C. The first grade refers to the appearance of the inner cell mass, and the second letter refers to the appearance of the outer layer of cells, the trophectoderm. And this was a study published last year from the IVF group at Cornell that looked for a correlation between the morphology, the grade of the embryo, and the success rates. And these are all euploid embryos. And they found that embryos with a high grade had a significantly higher pregnancy rates than those with a lower grade. And then they looked at miscarriage rates, and embryos with a poor grade had a significantly higher miscarriage rate in comparison to those with excellent grades. So in addition to knowing the euploidy rate of an embryo, the grade is also important in helping us to select the best embryo to transfer and important in optimizing your chance for success. Now, a successful IVF laboratory must be capable of efficiently culturing embryos to the blastocyst stage. And in general, about 50% of fertilized eggs will become blastocysts. 2 years ago, we built a new IVF laboratory with state-of-the-art air purification system, state-of-the-art equipment. We have a new lab director. And we switched our culture system from a sequential culture system where after 3 days of culture, you take the embryos out, replace the media, let them continue on for a couple more days, to a continuous culture system, which has the advantage of keeping those embryos undisturbed. So we look at them at the day after egg retrieval, look for signs of fertilization, and we keep them undisturbed for 5 days. And we're seeing a higher percentage of blastocysts, higher quality blastocysts, and higher pregnancy rates. So for IVF science, we constantly try to optimize success rates for our patients. So let's talk about eggs a little bit. The factors affecting egg quality include age, and as we've seen with increasing age, we see increased aneuploidy rate. Lifestyle, diet, exercise, stress, and smoking can affect egg quality. Obesity, and ovarian stimulation. As a woman ages, there's a lower number of eggs remaining. This is referred to as decreased ovarian reserve because every month the ovaries recruit a group of eggs, one ovulates and the other ones die off. These remaining eggs have lower quality due to lower levels of mitochondrial DNA and decreased mitochondrial activity with a decreased ability to produce the energy needed for implantation and normal embryo development. And there's a direct correlation between the number of mitochondria within the egg and its likelihood of fertilization and pre-embryo development. And there's evidence that women with repeat IVF failures often have compromised mitochondrial function within the egg. The final stage of egg maturation involves decreasing the number of chromosomes within the egg. And if that egg has poorly functioned mitochondria, there's increased risk of error, which results in an egg with abnormal numbers, which can result in an embryo that's aneuploid. So antioxidants are very, very important in women, especially in women of advancing age. They're important micronutrients for cell health because they help relieve oxidative stress, which is an imbalance of free oxygen radicals, which can damage eggs and sperm. Now, coenzyme Q is an antioxidant and mitochondrial nutrient. In mice, coenzyme Q supplementation has been shown to reverse the sign of aging in the eggs of older rats and to lower the incidence of aneuploidy. In a small randomized study in women treated with coenzyme Q, genetic testing of the eggs did show a decrease in aneuploidy of those eggs, but we need larger clinical studies to confirm this for general IVF patients. The recommended dose of coenzyme Q is 200 milligrams 3 times a day to improve egg health and to lower the aneuploidy rate. Good sources of antioxidants include pomegranates, berries, fruits and vegetables, green tea, chocolate, oregano, turmeric, and ginger. Diet can also have an impact on egg quality. A Mediterranean diet, which is good for all of us, includes less saturated fats, more seafood, fruits, and vegetables, may improve fertility. There's evidence that monounsaturated fats correlated to higher egg quality in embryos and birth rates, and polyunsaturated fat intake was inversely related to embryo quality. So there are things that we can do to try to optimize our results for an upcoming IVF cycle. Exercise. There's studies showing that moderate exercise can improve egg and sperm function by reducing oxidative stress, whereas vigorous exercise, more than 3 to 5 hours aerobic exercise each week, can lower the success rate with IVF. Stress can have an impact on your IVF cycle. Anxiety and depression have been correlated with IVF failure, and it's well documented that psychological intervention to reduce stress, to reduce anxiety, can have a positive impact on IVF success rates. Smoking can decrease IVF pregnancy rates in half and increase miscarriage rates, again through increasing the oxidative stress in the individual. And it's recommended that a woman stop smoking for 3 to 6 months before starting her IVF cycle. Now, ovarian stimulation. This is an interesting study that compared a mild ovarian stimulation protocol to a standard stimulation protocol, and they found a significantly lower incidence of aneuploidy in the mild stimulation compared to the standard protocol, suggesting that how we stimulate the ovaries, the amount of medication that we use, the number of days that we use that medication, can also potentially have an adverse impact on the egg quality and aneuploidy. So we're very meticulous when we monitor our patients and paying close attention to the dose of medication that we give and when we trigger ovulation, because we don't want to overcook the eggs and decrease the quality of those eggs that are delivered to the IVF laboratory. So what about sperm? Everyone begins with a basic semen analysis, which tells us the count, the motility, which is the percent that are swimming, and the morphology, which is the shape of the sperm heads. And we have detailed diagrams of variations in the sperm head shape. But it's a semen analysis is a very general screening test. It's not a great test of fertility. It fluctuates quite a bit from sample to sample, and it really doesn't assess sperm function very well. There's a newer sperm test which looks at sperm DNA fragmentation, and studies have shown that fragmentation of sperm DNA beyond a certain amount can interfere with blastocyst formation, implantation, and development of that implanted embryo. And there's several different assays that measure the sperm fragmentation. And in general, the results are most predictive of natural conception, intrauterine insemination, less so with IVF. What's most important is the quality of the DNA in that sperm that's actually fertilizing an egg. And when you have a semen sample for IVF, in general, even if it's showing high DNA fragmentation, if you can select a sperm with lower DNA fragmentation, you can optimize your chance of success. So a DFI is DNA fragmentation index. Less than 50% is considered good fertility potential, 16 to 25 fair fertility potential, greater than 25% is poor fertility potential. Things that can impact the DNA quality include varicocele in the testicles, some drugs, smoking, stress in the male, all increase oxidative stress that can potentially cause DNA damage. So the clinical value of obtaining this test is it may give us a better understanding of the fertility potential of the sperm. It may explain some unexplained infertility and miscarriages. And if you find a high DNA fragmentation, that's the time to refer it to a reproductive urologist because it may be correctable. And this is a study looking at the IVF outcome in men with DNA fragmentation less than 29%, with success rate with 41%. In men with greater than 29%, it had decreased to 25%. Now, there is some evidence in men with high DNA fragmentation and ejaculated sperm that it's actually lower in testicular sperm. So there have been reports, series of patients, where urologists at the day of the egg retrieval have extracted sperm directly from the testicle to do ICSI with testicular sperm with resulting higher pregnancy rates. Now, what factors affect the quality of the sperm in men? Well, men aren't unaffected by age. In general, studies show a decrease in most sperm parameters over the age of 35, slightly decreased blastocyst formation and pregnancy rates, and increased DNA fragmentation. And when we have an aneuploid embryo from a miscarriage, we usually attribute it to an egg factor, but there is some evidence that the age of the sperm provider can also increase the incidence of aneuploidy. And there is evidence of an increased risk for autism and schizophrenia in men over the age of 40. Obesity has a negative effect on sperm as it does on eggs. It can decrease sperm parameters, increase DNA fragmentation, lower IVF pregnancy rates, and increase miscarriage rates. Diet and exercise, moderate exercise can improve sperm quality. Too much exercise can have a negative impact. Antioxidants are helpful for men as they are for women. They can improve sperm motility and decrease DNA fragmentation. Alcohol in moderation is okay. In excess, it's a no-no. Sperm don't like it. And men, of course, should avoid testosterone, which will suppress sperm production. And propecia can also have a negative effect on sperm. And anything increasing heat in the testicles is bad for sperm. So avoid steam rooms, saunas, jacuzzis. And supplements that can be beneficial for men include omega-3 fatty acids, vitamin C, coenzyme Q, and folic acid. So how do we optimize embryo quality and pregnancy rates? Well, we can start at a younger age by freezing eggs, freezing sperm, freezing embryos. I'm now seeing couples today that are freezing embryos for use, 2 to 5 years later. Have a healthy lifestyle, healthy diet, healthy body weight. Supplement with mitochondrial nutrients and omega-3 fatty acids. Ask your doctor to very carefully select your ovarian stimulation protocol and to be monitored closely. You want your embryos to be cultured in a proven IVF laboratory system. PGS is helpful. And of course, you want an optimal uterine environment, and that we haven't talked about that today, but it's very important. Thank you for your attention.